A last chance therapy is giving new hope to cancer patients. One Nebraska patient says CAR T-cell therapy did what chemotherapy and bone marrow transplants could not. Now doctors say it could help others. 3 News Now reporter John Kipper looks at how.
After going through treatment after treatment for lymphoma, Peetsch of Lincoln was out of options when he came to Nebraska Medicine to try a new procedure. But just weeks after starting the CAR T-cell treatment, his cancer was in remission.
Just going to do your exam here, make sure we don't have any new lymph nodes.
Peetsch beat Non-Hodgkins Lymphoma once, but 5 years later, the disease came back. He underwent chemo and even a bone marrow transplant in Kansas, but doctors still told him his treatment was failing.
I went in and it didn't work. So I still had the full cancer. It was still there, everything.
So Peetsch came to Nebraska Medicine to undergo a new procedure called CAR T-cell therapy. Right before his procedure, his cancer flared up in his abdomen, putting him in extreme pain. But once the treatment began, that pain and his cancer began to vanish.
All the cancer cells from what I have wrong with me are on nerves, everything. So as soon as the pain's gone, I know it's working. Because I can feel the pain actually leaving my body.
His intuition was correct. Just a few weeks ago, he came in for another visit.
Dr. Vos told me it was in remission, and I just started crying. And now they have to accept hugs from me because I normally don't go around hugging people, but it means a lot.
The CAR T procedure was just made available for patients this year. The treatment modifies existing cells from a patient, puts the cells back into the patient's body, and then those modified cells fight the cancer cells. Dr. Julie Vos says the treatment is considered a last resort because its long-term effects are still being researched.
It's too new. We don't know for sure what the long-term outcome of this is. It's only been around a few years, and so we don't have 10, 20-year information to know that.
Peetsch says he has plenty of living left to do and has the CAR T to thank.
And I would have died. And how they said it is if without the CAR T, I didn't have a chance. And if the CAR T does not work, all they can do is make me comfortable.
John Kipper, 3 News Now.